So, hi, this is Jen from the Saratoga Springs Public Library, and thank you for joining us today for our community conversation. In each episode, we plan on introducing you to one of our local community organizations and telling you a little bit more about what they do and what they offer the community. So today's guest is Maggie Fronk, and she is the Executive Director from WellSpring. Welcome, Maggie.
Hi, so pleased to be here.
Hi, thanks for being here with us. So, could you tell us a little bit more about your role in the organization?
Okay, for folks who aren't familiar with WellSpring, we are the domestic violence and sexual assault agency for Saratoga County, and I am the executive director. So what we do is we provide a full range of crisis and support services and prevention programs around the issues of relationship and sexual abuse.
Great, thank you. And can you tell us a little bit about your organization's mission or history? You mentioned a little bit there about what the organization does.
Yep, so I'll tell you about some of our services. We do 24/7 crisis services, including emergency hotline, emergency shelter, accompaniment to police, to the hospital. But we also do a range of other services that are support services, counseling and legal advocacy, and helping people with basic needs and housing, as well as prevention programs.
Oh, wonderful. That's all good for people to know about. Thank you. So what do you see as the most pressing need or concern right now in the community?
Okay. I certainly think when we're talking about folks who are in an abusive relationship, the COVID health crisis has also caused a crisis that's hard for them. We hear about the stresses everyone's having related to the health crisis. Folks are concerned about their employment. They are concerned about their health. They're maybe working from home while still homeschooling their kids at the same time. Those are stressors. When you add to that domestic violence, it can become even more difficult. When 24/7 that family is living together with those stressors, abuse can escalate.
And are you finding that to be the case? You're hearing that that's the case? The escalation of that? Yeah.
We've already seen the numbers go up. Our hotline calls from February to March increased by 110%.
Wow.
So they've more than doubled. And yet we know that we haven't even started to see the rise yet, because a lot of people are maybe living in that abusive situation, but the world outside is a little bit scary right now. So they're probably not going to
I'm sorry, could you say
be
that again?
comfortable calling maybe till the world outside seems a little less scary.
Gotcha. So if
Sure.
people need
I
help,
think some people living
sorry, go ahead.
I think people might be living in abusive situations, might be hesitant to call for help because the world outside seems scary to them. So we predict as the health crisis starts to abate a little bit, we're going to hear from a lot more folks who've been victimized about how it's been for them.
What their experience has been like during this. So if there is
Yeah.
anybody that needs help now, what would you say would be the best way to reach out and get that help?
Okay. We need folks to know that we are here 24/7 for them. And we have all of the same service we ever did. We're just doing some of them a little bit differently. So they can call our hotline anytime at 518-584-8188. And we also implemented a new web-based chat line. So if you're in a situation where you can't talk freely on the phone, maybe the kids are home or the person who's abusing you is there, you can reach us by typing on your phone, on your computer, through our chat line. And you can find out about that on our website, which is wellspringcares.org.
Great. And it looked like on your website too that people could do that and even hide their screen if there was any concern about somebody overseeing what they were trying to connect to.
Yep. So we have a lot of things about safety, and I want folks to know you're not alone in this, and you don't need to be in a crisis to call. You can just maybe need someone to talk to, and we're available there. We're available by phone or the chat line. So don't hesitate to reach out for help.
Great, great. And are there any other resources that you'd like to let people know about in the community, either that you work with or that you just think would be good tools for people to know about if they are having some questions or concerns in this area?
Yeah, so we work very extensively with a lot of other human service organizations. And we also provide a lot of services folks don't know that we do. For example, I talked about a housing program, we have a food pantry. So if you're having any kinds of concerns, give us a call and we can either help you or link you to the agency that you might need.
Wonderful. Thank you. Are there any other things that you'd like to tell us about? You've done a
No,
great job of letting us know what you offer.
I think I think this is a hard time for everyone, but one of the things that we can do is realize we're all connected. So if you don't need the hotline or the chat line, it's good to know about it in case someone else does, and just to be aware that in these really trying times, abuse can escalate. So when you're talking to somebody, listen to what they might be going through and direct them to a resource if you're concerned for them. And we will get through this.
Great. Thank you so much, Maggie. We really appreciate it.
Yes, and thank you for helping us to get the word out.
Yeah, absolutely. So, for all of you listening or watching this at home, any of the things that we talked about today with the resources, both WellSpring's webpage URL, phone number, hotline, chat information, and anything else that we discussed for resources will be available following this video. So, please, again, if you know someone that needs the service or you yourself, please feel free to reach out. And thank you again, Maggie, for joining us today. We, again, really, truly appreciate all the work that you do.
Thank you.
Bye bye.